Question 1. What is the nurse's first intervention for a patient in hypovolemic shock? A. Administer 4 fluids rapidly. B. Place the patient in high Fowler's position. C. Apply warm compresses to extremities. D. Monitor hourly urine output only. Answer. A. Administer 4 fluids rapidly. Question 2. Which is a classic early sign of shock the nurse should recognize? A. Weak, thready pulse. B. Hypertension and bradycardia. C. Bounding peripheral pulses. D. Warm and flushed skin. Answer. A. Weak, thready pulse. Question 3. What is the priority nursing action for a patient with low blood pressure and signs of shock? A. Place patient flat with legs elevated. B. Administer oral fluids. C. Apply cold packs to the abdomen. D. Encourage the patient to ambulate. Answer. A. Place patient flat with legs elevated. Question 4. What is the most appropriate action for a nurse managing septic shock unresponsive to fluids? A. Start norepinephrine infusion. B. Administer acetaminophen for fever. C. Reposition every 2 hours. D. Apply sequential compression devices. Answer. A. Start norepinephrine infusion. Question 5. In shock management, what should the nurse monitor closely to evaluate kidney perfusion? A. Assess for decreased urine output. B. Check for bradycardia and hypertension. C. Monitor for facial flushing. D. Observe for increased LOC. Answer. A. Assess for decreased urine output. Question 6. A patient in shock has mottled skin and a systolic blood pressure of 68 mmHg. What is the priority? A. Contact the provider immediately. B. Lower the 4 fluid rate. C. Encourage the patient to eat. D. Document the finding and continue care. Answer. A. Contact the provider immediately. Question 7. What is the first-line emergency treatment for anaphylactic shock? A. Administer epinephrine IM. B. Encourage deep breathing exercises. C. Provide oral antihistamines. D. Apply topical corticosteroids. Answer. A. Administer epinephrine IM. Question 8. Which finding is a priority indicator of progressing shock? A. Sudden drop in blood pressure. B. Increased bowel sounds. C. Dry mucous membranes. D. Elevated oxygen saturation. Answer. A. Sudden drop in blood pressure. Question 9. A trauma patient shows signs of hypovolemia. What intervention should the nurse anticipate? A. Rapid 4 bolus of normal saline. B. Administer furosemide 4. C. Encourage oral hydration. D. Place patient on a 24-hour urine collection. Answer. A. Rapid 4 bolus of normal saline. Question 10. What is the nurse's immediate priority when managing a patient in anaphylactic shock? A. Maintain airway and breathing. B. Perform full skin assessment. C. Apply an abdominal binder. D. Reposition the patient frequently. Answer. A. Maintain airway and breathing. Question 11. What hemodynamic finding indicates hypovolemic shock? A. Low central venous pressure, CVP. B. Increased systemic vascular resistance. C. High urine output. D. Bradycardia. Answer. A. Low central venous pressure, CVP. Question 12. Which clinical sign suggests early shock and should prompt immediate assessment? A. Tachypnea and restlessness. B. Cool, moist skin. C. Increased LOC. D. Bounding pulse. Answer. A. Tachypnea and restlessness. Question 13. Which nursing precaution is most appropriate when initiating high-risk vasopressor therapy? A. Place the patient on high-alert drug precautions. B. Administer potassium chloride for push. C. Delay interventions until labs return. D. Discontinue all vasopressors. Answer. A. Place the patient on high-alert drug precautions. Question 14. What is the most effective strategy for preventing mortality in septic shock? A. Early detection and treatment. B. Administer antibiotics after 12 hours. C. Wait for hypotension to confirm diagnosis. D. Focus only on respiratory care. Answer. A. Early detection and treatment. Question 15. What is the nurse's priority assessment for evaluating patient response to shock treatment? A. Priority vital signs. B. Blood glucose check. C. Skin turgor assessment. D. Capillary refill time. Answer. A. Priority vital signs. Question 16. Which combination of vital signs is most consistent with neurogenic shock? A. Hypotension and bradycardia. B. Hypertension and tachycardia. C. Cool, clammy skin and bounding pulse. D. Elevated white blood cell count. Answer. A. Hypotension and bradycardia. Question 17. What should the nurse monitor closely to detect changes in perfusion in a shock patient? A. Monitor mental status closely. B. Delay neurological checks until stable. C. Use restraints immediately. D. Avoid communicating with the patient. Answer. A. Monitor mental status closely. Question 18. What finding is most expected in early distributive shock, such as sepsis? A. Low systemic vascular resistance. B. High preload and increased cardiac output. C. Elevated hemoglobin and hematocrit. D. Rapid improvement with diuretics. Answer. A. Low systemic vascular resistance. Question 19. What is the primary cause of vasodilation in septic shock? A. Infection and vasodilation. B. Blood loss and dehydration. C. Cardiac pump failure. D. Adrenal insufficiency. Answer. A. Infection and vasodilation. Question 20. What is the major physiological outcome of all types of shock if not promptly treated? A. Reduced tissue perfusion. B. Increased afterload. C. High urine output. D. Hyperkalemia. Answer. A. Reduced tissue perfusion. Question 21. Which assessment finding requires immediate intervention in a patient with suspected septic shock? A. Mottled skin and altered mental status. B. Warm skin and flushed appearance. C. Oxygen saturation at 96%. D. Blood pressure of 100/70. Answer. A. Mottled skin and altered mental status. Question 22. What lab result would most concern the nurse in a patient with cardiogenic shock? A. Elevated troponin level. B. Decreased white blood cell count. C. Increased platelet count. D. Low hematocrit. Answer. A. Elevated troponin level. Question 23. A patient in neurogenic shock is bradycardic and hypotensive. What is the priority nursing intervention? A. Administer vasopressors as ordered. B. Place patient in reverse Trendelenburg. C. Provide high-flow oxygen via nasal cannula. D. Encourage fluid intake orally. Answer. A. Administer vasopressors as ordered. Question 24. What initial action should the nurse take when caring for a trauma patient showing signs of hypovolemic shock? A. Apply pressure to bleeding site and elevate legs. B. Prepare for MRI. C. Encourage deep breathing and coughing. D. Elevate head of bed. Answer. A. Apply pressure to bleeding site and elevate legs. Question 25. What medication is typically administered first for anaphylactic shock? A. Epinephrine. B. Diphenhydramine. C. Albuterol. D. Prednisone. Answer: A. Epinephrine. Question 26. Which vital sign change would indicate early progression from compensatory to progressive shock? A. Decrease in systolic blood pressure. B. Decrease in respiratory rate. C. Increase in urine output. D. Bradycardia. Answer: A. Decrease in systolic blood pressure. Question 27. A patient receiving norepinephrine has a drop in urine output. What is the best nursing action? A. Notify the provider immediately. B. Decrease fluid rate. C. Administer furosemide. D. Reassess urine output in 4 hours. Answer: A. Notify the provider immediately. Question 28. What assessment data supports the diagnosis of obstructive shock? A. Jugular vein, distension, and hypotension. B. Bounding pulses and hypertension. C. Warm skin and flushed appearance. D. Increased urinary output. Answer: A. Jugular vein, distension, and hypotension. Question 29. In early distributive shock, what is the typical skin appearance? A. Warm and flushed. B. Cold and clammy. C. Cyanotic. D. Pale and mottled. Answer: A. Warm and flushed. Question 30. What nursing diagnosis takes priority in a patient experiencing shock? A. Ineffective tissue perfusion. B. Imbalanced nutrition. C. Impaired physical mobility. D. Disturbed sleep pattern. Answer: A. Ineffective tissue perfusion. Question 31. A nurse prepares to administer 4 fluids to a shock patient. Which fluid is most appropriate initially? A. Normal saline. B. Dextrose 5% in water. C. Half normal saline. D. Lactulose. Answer: A. Normal saline. Question 32. What is the primary goal of vasopressor therapy in shock? A. Increase perfusion to vital organs. B. Promote diuresis. C. Decrease afterload. D. Lower cardiac workload. Answer: A. Increase perfusion to vital organs. Question 33. Which sign indicates improved perfusion in a patient with shock? A. Capillary refill less than 2 seconds. B. Blood pressure 100/60. C. Respiratory rate of 32. D. Urine output of 10 ml/hour. Answer: A. Capillary refill less than 2 seconds. Question 34. What is the priority nursing action for a patient developing shock after major surgery? A. Administer oxygen and monitor vital signs. B. Encourage oral intake. C. Apply compression stockings. D. Monitor blood glucose. Answer: A. Administer oxygen and monitor vital signs. Question 35. A nurse notes that a patient's mean arterial pressure is 50. What should the nurse do first? A. Notify the provider. B. Check the hemoglobin level. C. Raise the head of the bed. D. Apply warm blankets. Answer: A. Notify the provider. Question 36. Which lab value should the nurse monitor to evaluate metabolic acidosis in shock? A. Serum lactate. B. Hemoglobin. C. Platelet count. D. Sodium. Answer: A. Serum lactate. Question 37. What symptom is most associated with late-stage shock? A. Unresponsiveness. B. Mild tachycardia. C. Warm extremities. D. Normal blood pressure. Answer: A. Unresponsiveness. Question 38. What is the role of the nurse in preventing shock-related complications in high-risk patients? A. Early identification of at-risk individuals. B. Administering sedatives prophylactically. C. Withholding fluids to prevent overload. D. Encouraging prolonged bed rest. Answer: A. Early identification of at-risk individuals. Question 39. Which intervention is most appropriate during the refractory stage of shock? A. Provide comfort and end-of-life care. B. Administer additional 4 fluids. C. Begin aggressive fluid resuscitation. D. Increase oral intake. Answer: A. Provide comfort and end-of-life care. Question 40. A nurse delegates vital signs to a UAP in a patient receiving vasopressors. What instruction is essential? A. Report any systolic blood pressure below 90 immediately. B. Avoid disturbing the patient during assessment. C. Use manual BP cuff only. D. Take vital signs every 2 hours. Answer: A. Report any systolic blood pressure below 90 immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!